Most gut health concerns don't arrive with an obvious explanation. They start as a subtle sense that your body is off balance, a shift in rhythm that leaves you wondering what has actually changed. You might notice ongoing diarrhea, a persistent dull ache, or a level of fatigue that doesn't resolve with rest. Because these changes happen inside the digestive tract, they are shielded from view. Without clinical data, you are left to guess whether the cause is a minor irritation or something requiring urgent medical attention. Stool testing serves as the primary bridge to this internal environment, allowing clinicians to extract objective data from a space that is otherwise impossible to see. However, it's a common mistake to assume that all stool tests are looking for the same biological indicators. Because different conditions leave different markers behind, the specific symptoms you experience determine which biological signal needs to be measured first. The first line of questioning focuses on the immune system. Is the bowel lining currently inflamed? An IBD stool test measures two specific proteins, calprotectin and lactoferrin. White blood cells release these the moment they detect gut inflammation. This chart shows how protein concentration reflects the immune response's intensity. High levels suggest an active inflammatory process. Identifying these markers helps doctors distinguish inflammatory bowel diseases, like Crohn's or colitis, from non-inflammatory conditions like irritable bowel syndrome. This test is typically used when a patient experiences recurring flares, intense abdominal pain, or a sudden frequent urgency to use the bathroom. Ultimately, the IBD test provides a measurement of the body's defensive immune reaction rather than identifying a specific disease. The second category of inquiry is the fecal occult blood, or FOB test. In a medical context, occult simply means the blood is microscopic and hidden from the naked eye. The FOB test targets physical tissue damage. It detects trace amounts of blood leaking from structural issues like polyps, fissures, or ulcers. This blood remains completely invisible within the stool, undetectable without a chemical reagent to flag its presence. Clinicians often prioritize this test when a patient presents with unexplained weight loss, anemia, or any visible changes in the color or consistency of the stool. Because hidden bleeding can be an early indicator of bowel cancer, the FOB test is a standard component of colorectal referral pathways. By identifying structural damage rather than inflammation, the FOB test serves an entirely different role in a medical assessment. It is important to note that neither test provides a final diagnosis for Crohn's, colitis, or cancer on its own. Instead, a positive result acts as a triage tool. It provides the clinical justification needed for more invasive and precise procedures, such as an endoscopy or a biopsy. A negative result is reassuring, suggesting that inflammation or bleeding wasn't present at the time of the sample, but it doesn't mean you should ignore symptoms that persist. If the discomfort is located in the upper digestive tract, different diagnostic tools, such as an H. pylori test for stomach ulcers, may be more appropriate. Moving from a state of uncertainty to one of clinical insight starts with identifying the specific biological signals your body is sending. By choosing the right test for your symptoms, you take the first measurable step toward resolving the issue.